in the morning, have a hard time going to the bathroom at night, and they usually come right in the office after experiencing this type of pain.
We've got a few callers, but let us just go through just a few more minutes
okay.
of this heel condition, and then let's definitely open it up.
Mm-hmm.
Very, very interesting. I find that it usually takes about 2 weeks for people to come in.
Oh, yeah.
And I've also found out that the longer the people have had it, the harder it is to go away.
Yeah.
Most common causes of heel pain, it can be fractures, it can be people with gout, but most of the time the cause is plantar fasciitis. There's a ligament that runs from your heel to your toes, and it's basically microscopically torn. We've gone through the signs and symptoms. How do you treat a heel spur syndrome?
Like I said, it all depends upon the age of the patient. The first thing we do, we go through conservative treatment. Go through conservative treatment for a good while before we even consider any type of surgical intervention. Such as, well, our conservative treatment includes physical therapy. First, it includes a good X-ray of the foot, so we can tell whether it's not a bone abnormality or just plain or plantar fasciitis or heel strain. And when we determine the actual cause of the heel pain, then we usually augment it with some type of physical therapy or injections, steroid injections, taping of the foot, non-steroidal anti-inflammatory medication, usually something like Motrin or Advil. I guess I don't get in trouble for saying names, do I? Some type of anti-inflammatory medication. Yeah. Some type of anti-inflammatory medication. And stretching exercises do work. So it all depends upon the patient, and it all depends upon how resilient they are to types of treatment. So what are some of the things you do?
Well, the most important thing, I feel, is to take care of the cause. If a person has a high arch foot, I think we need to redistribute the weight. If a person has a collapsed arch, I think we need to recreate that arch. Most importantly, what I do is I tape and pad the person, and what that does is put the foot in the best functioning position, takes a weight off the plantar fascia. Down the road, I feel we're going to get them into some type of custom-made arch support, which is what we call an orthotic, and I have an example of what one looks like over here. It doesn't fit throughout the whole shoe. It actually goes from the heel to the ball of the foot. It's usually very lightweight and thin, but there are a few different styles of them. That is my first line of defense. If the conservative care, if the taping and padding and the orthotics don't work, I then go through some types of cortisone injections up to a series of 3. I'll give some anti-inflammatory drugs, whether it be a cortisone or a non-steroidal anti-inflammatory drugs like ibuprofen or naproxen. Sometimes we'll even give, obviously, some scripted anti-inflammatory drugs. I avoid doing surgery unless I exhaust 4 to 9 months of conservative care.
90% of the time, people respond very well to conservative care.
Absolutely.
And if you have to go down the route of surgical intervention, there are several surgical options that are available, and I like to tell the patient about all of them and let them make the decision.
Okay. Why don't we take a phone call first?
Doctors?
Yes.
Can you get, especially I know some will be coming on later on, could you stress the importance of wearing the proper type of footwear? And I try to tell my daughter wearing those flip-flops every day is a no-no.
Absolutely. You know, the flip-flops are probably one of the bigger reasons why we got more.
Cool.
They're cool, but they actually bring a lot of pathology to our office. Yes, shoes are really important. You cannot go barefoot. What that does, especially the flip-flops, there's no arch support. They put a lot of pressure on the plantar fascia. But it's usually not the kids with the plantar fasciitis that come in. It's the older adults. It's the ones that are the weekend warriors that are getting back into health, that are overweight, that are wearing the flip-flops, and that causes problems. So most importantly, not only do we have to get people into orthotics, but then they have to also wear good supportive shoes or shoes with it so they can wear the orthotics.
And I believe in this cold weather, you're not having any trouble convincing her to get out of those flip-flops.
Absolutely not. Anyways, surgically, there are many forms of surgery one can do. Again, I stress that 90% of the time surgery is not needed. One of the procedures that I do, it's been in vogue for about 10 years, is called EPF, or endoscopic plantar fasciotomy. Basically, what that is 2 small incisions are made on the inside part of the heel over here and on the outside part there. And through the, it's done the same way as arthroscopic knee surgery. We actually insert a scope through the skin underneath as you can see here, underneath the fat, between the fat and that ligament. And then what we do is we cut a third of that ligament from the big toe to maybe 1/3 of the way over to the heel. And 90% of the time, I can get rid of at least 75% of the pain. It's nothing that you're not going to get up and instantly feel better, but you will feel better over time. It is a surgical procedure, though.
One thing, Dr. Ken, I like to stress upon my patients is surgery is not an end-all of plantar fasciitis or heel pain.
Oh, absolutely
not. A lot
not.
of times you can get rid of the problem for a good year, 2 years, 3 years, but once that patient puts on a good 30 pounds, that heel pain is going to come right back.
Well, there was a study out that said that statistically, if you did surgery on every heel pain that came into the office initially, you're only going to get 50% results. So surgery is not the end-all and be-all. But if you exhaust 4 to 9 months of conservative care, then the success rate goes up to 90%. And I tell my patients, 90% of the time, I can get rid of at least 75% of the pain.
And Dr. Jacoby, what I usually explain to my patients is there's a ligament that goes from the ball of the foot all the way to the toe area. And when you lay down for a long period of time or sit down for a long period of time, that ligament has a tendency to tighten up. Then when you get up and start walking, it starts pulling from the heel, and that's how heel pain starts. And eventually when you continue to pull from the heel, you'll get like what you call a little heel spur coming off of the back of the heel. And when you take an x-ray, you'll see the spurring on the back of the heel, like this is our bones. You'll see a big spur coming on the back of the heel. This is the heel of the foot. And after you get that big spurring on the back of the heel, that's what causes the pain. Yeah.
Is there a caller?
Hi.
Yes.
Oh, good evening. I have a question. What do you do like when you get menopausal and the bottom of the foot becomes extremely dry? You get all this dry skin. What are your suggestions for that?
Well, I'm gonna dump that off to John Dell because I haven't gone through, even though my wife thinks I've gone through menopause.
One thing about becoming menopausal, you have a tendency, you have a hormone change, you have a tendency your skin as a whole gets dry. I'm sure your foot is not the only place where it is getting dry. Usually you get a dry scalp. People have a tendency to get more dandruff. People have a tendency to get more scaly all over. And usually that can be taken care of, like if you're going to be placed on a hormone replacement type of medication, or sometimes it'll just pass. But if you have extremely dry skin, you can use some of the over-the-counter things like, I hate to say Eucerin cream, or you can go to...
Those creams have mineral oil in them. I'm trying to find something that doesn't have mineral oil.
Why you don't want to use mineral oil?
Because this creates like a barrier on your skin.
Well, that's in theory what you want to try to do, so you can keep the moisture on in.
Yeah, you want to have some kind of emollient. You can go to your podiatrist and they can recommend some type of cream. They can give you a prescription for some type of cream, like triamcinolone.
Sure.
That doesn't have mineral oil in it.
What you can do, if you're looking for a physician, you can call the Illinois Podiatric Medical Association, and their telephone number, we don't have that written down unfortunately, but is area code 312-427-5810. And you can talk to someone and they can find a podiatrist. Yeah,
they can refer you to a podiatrist. And here's the website, www.ipma.net, and you can find a podiatrist in your zip code.
Okay,
thank you for your call. Yes?
Hello.
Good afternoon.
Hi, good afternoon. I'm a waitress. I have chronic tendinitis on my left foot, and I have very bad spurs on my right foot. I want to know, I get cortisone shots, but it doesn't seem to help me and doesn't stay too long.
Are you overweight?
Yes.
Okay. Unfortunately, if you drop 10 to 20 pounds, a lot of your heel pain will go away.
I always tell my patients an overloaded truck wears his tires out quick.